Well, many children and teenagers having a mental health crisis end up in hospital emergency rooms because there's nowhere else for them to go.
It's a sad reality, and now a new study shows they often don't get professional help after they leave there. Some just land back in the ER again. It happens all the time. Research this month found more than 1/4 of kids return to the hospital within 6 months. Some of them return within a week. National investigative correspondent Stephen Stock and his team visited the front lines where medical staff, parents, and kids are all dealing with what has often become a life or death crisis.
You should know this story includes frank conversations about the mental health crisis that for some might be difficult to hear.
Michaela shares her story.
You're just kind of left alone.
Not because of where she is at age 20.
It kind of feels hopeless.
But because of where she was just a couple of years ago.
For me, I would be crying out for help.
Inside a hospital emergency room in Colorado for the 8th time, suffering a mental health crisis.
It wouldn't happen until I came to a point where it was too late.
Michaela ended up in the ERs because she was suicidal or in acute crisis. The first time when she was 12. She now considers herself a survivor.
It definitely made me stronger.
I was in the ER for 19 days.
Daniel considers himself a survivor too.
The ER is inhumane and not the right place to go for mental health. All right, let me show you the oldest one.
Daniel shared his story after a mental health crisis landed him in a Boston ER when he was 17. He's been in the ER 3 different times in the last year alone.
And they don't get what they need. They are still trying to find the help they need, and it's so damn difficult.
So many stories we heard, different journeys, one problem.
Stuff to do.
Young people suffering a mental health crisis ending up in the last place doctors think they should.
This is such a big problem around the country. This is the front lines now on treating mental health among juveniles, is the emergency department.
It is not an ideal place to be.
In January, we spent a day with Dr. Kevin Carney, head of the ER at Children's Hospital Colorado.
This morning when I came in, we had 5 patients who came in overnight into the emergency department for mental health reason.
Children's Hospital Colorado says last year system-wide, they saw an average of 554 children every month in their ER with mental health issues. Housed there to keep them safe, but where the children got little to no treatment.
The PsychD, hoping I could check bed status for...
Staff members spend hours every day calling around Colorado.
No beds today.
Thank you.
Looking for places where kids can get treatment.
Maybe across the whole system 4 or 5 beds in the whole state today.
Okay, thank you.
And I have 8 waiting for beds already.
Okay, no beds today.
And I have 4 more to be seen today, and it's only noon.
Which is why so many children wait hours, days, even weeks inside the ER.
We've seen a significant rise.
We found a similar crisis at Cook Children's Hospital in Fort Worth, Texas.
But we're seeing even younger and younger kids, 8 and 9-year-olds, that are expressing that they want to hurt themselves, that they want to die.
Over the last 2 years, they've seen an average of 330 kids a month with mental health issues in their ER.
So we're in one of our psych safe rooms.
Kids in Fort Worth and across the country wait in ER rooms like this one, stripped down for their protection.
They prevent you from being able to harm yourself. We've had length of stays over 36 hours in this room.
You feel terrible for the families when they're trapped here for hours, days on end trying to find placement.
More than 60% of youth with major depression don't receive any mental health treatment. Our investigation found 41 states with a severe shortage of child psychiatrists.
We got to go to where folks are.
The person in charge of this, Health and Human Services Secretary Javier Becerra. We met with him in Dallas during a panel with young black men.
I was actually suicidal my senior year of high school.
Because when people don't feel safe, people don't talk, people don't speak, people don't say anything, and they just deal with it. That's why you have people committing suicide. That's why you have people turning to drugs and alcohol, because they don't know where else to go.
They're crying out.
It starts with the youth.
Shame on us that we haven't prepared.
Is that acceptable that we've got young people in ERs all over with mental health issues all over this country?
No, it's not acceptable. It's not care. It's housing them.
Why hasn't the federal government done more until now?
It's pretty simple. Money.
We checked. And the Biden administration has dedicated more money to juvenile mental health than previous administrations. $1 billion over the next 5 years to pay for things like medical school to increase the number of mental health specialists, and a goal of doubling counselors in schools. But critics say those one-time grants are short-term answers.
Does Congress need to step up and treat this as a continuing problem that they need to fund better?
Absolutely. And that's why President Biden called this part of his unity agenda. This is something where red or blue, Republican or Democrat, we all know someone who needs help.
Our kids need us to be there for them.
You don't always see this kind of emotion from a school superintendent. But mental health is such a priority for Chris Smith and his Denver area community that they voted for a $15 million bond to build a combination mental health treatment center and school due to open this fall. Intensive care and classrooms where kids can slowly transition back to traditional school.
This is personal for you. Why?
Because I've been impacted by suicide and I've been impacted by mental health. And so we need to do whatever we can to engage and push in and make sure that our kids feel loved, valued, and invested in.
Smith admits not every school district can pay for a solution this big, but for him, it's an investment they can't afford not to make.
Our kids need to know who they are, because if they walk into our schools and they feel loved, they feel invested in, and they feel valued, they won't hurt themselves and they won't hurt others.
Texas has a severe shortage of child psychiatrists. According to data analyzed by CBS News, 81% of Texas counties have no child psychiatrists, zero.
To meet the needs of all children, just in Dallas and Tarrant counties, more than 200 child psychiatrists would need to be hired in each county. To see the number of child psychiatrists in your area, you can check out the map posted at cbsnews.com. You'll also find resources for families there.
Our thanks to Stephen Stock, by the way, for that story. Yeah. If you or someone you know, folks, is in crisis, you can get them help from a suicide and a crisis lifeline counselor by calling that number or texting the 3-digit number right there on your screen, 988. It is a useful resource. It is available to you 24/7, so if you need it, please use it.